Can you guys see my screen?
Yes.
Okay. Is it possible for someone to go to read rather, please? Kindly.
Yeah, I'll do it.
Okay, thank you.
Which one of the following drugs is amphoteric?
These are all antibiotics, right? Um, hmm.
The answer is C.
Rofloxacin. Okay.
Okay. All the following are indicators used in titrations with acidic range. Endpoint except
So I'm saying there is methyl orange, bromophenol, tetrabromophenols, alizarin, sodium sulfonate. Okay, just 1 minute. Okay, so for acid range, I've seen that phenolphthalein and methyl orange are usually used, but I'm not sure about methyl red and bromophenol.
from what I've seen,
Mm.
they're all used in for the acidic range. Or I think it's what is it? Bromophenol. Bromophenol blue, I think it's in the
These.
neutral range, maybe that's why.
Okay, could be.
Yeah, but I'm not too sure about this one.
Anyone else? Oh, what am I doing? Okay, another thing is showing me litmus, phenolphthalein, and methyl orange are also used, but litmus is not part of the option. Bromophenol, you said it's neutral.
Yeah, but I'm not sure because the one I'm seeing it's bromothymol and bromophenols. I don't know if it's the same or
Yeah, I'm saying the same thing here.
yeah.
It could be bromophenol. Anyone else? I think. I think we can just move
I
to the
think I think it's phenolphthalein.
phenolphthalein.
Yeah, it's in the acidic in the basic range, not acidic.
Okay.
Yeah. I think even Chai said something.
Oh, Chai has said something. Okay.
Yeah, he said phenolphthalein is typically used as an indicator in titrations for basic. Yeah.
Okay. All
Okay.
right.
Which of the following principal salts is used as buffer mixtures? Phosphate, right?
Yeah, I think so. Principal salts. Okay, the most commonly okay, wait, never mind. I'm saying acetate and sodium acetate with boric acid and borax. Okay, I don't know what the hell that is. But okay. Anyone?
I think I'd also go with phosphates.
Phosphate, yeah?
Yeah.
Okay. Okay, we can't be spending a lot of time on one question, so I think we can just move. Whoever gets a different answer can just highlight it and send it to the group.
All
Oh,
the,
sorry, continue.
all the following organic compounds can form complexes by chelation with metals except
I'm seeing somewhere that the the functional group forms complexes with all metallic elements except alkali metals. So, but it's totally unrelated to this. Okay, someone's written sulfanilamide can exhibit both acidic and basic properties in different chemical environments. What question is this for? Number 65.
That question is a bit tricky because I saw somewhere that even amoxicillin has like amphoteric property.
Yeah. Okay.
Just mark that question.
Yep. On it. I'll also just mark this one. Was it this one? Okay, there was one that we were supposed to mark anyway. Okay. So
I think it's B, but not too sure. Just mark that question.
I'm trying to look for it, but once I get it, I'll just correct the answer if it's not this. Yeah, and then I'll just okay, according to
It's
Google,
B.
and diazepam all have functional groups that can participate in gelation with metal ions, allowing them to form complexes. So 8-hydroxyquinoline and proaguanil. So the answer is diazepam. No, thiourea from what Nighty Night has sent.
Okay, we just move on to the next one, then
Yeah.
we'll see. Which of
Okay.
the following organic functional groups has the highest hydrogen bonding potential? Yeah, either B or C. Yeah, C, I guess.
How did you come to that conclusion?
You see, where like when you're talking about hydrogen bonds,
Mm.
it's between a hydrogen and an oxygen.
Yeah.
So I think C, because that oxygen would have two lone pairs.
Mm-hmm.
So there would be more hydrogen.
Yeah.
Highest bonding potential.
Hiral,
Yeah.
yeah,
Does that
about Nene, okay, what you've said about the hydrogen bond.
Mhm.
I thought hydrogen bond was between hydrogen atom and an electronegative atom such as oxygen, uh, even nitrogen. Only that in oxygen it will have aura stronger, something like that. Like we saw something of the sort when we were
Oh,
looking at
oh,
hydrogen.
yeah.
Uh,
Yeah, so I think it's the like it being a strong
Carbon.
bond with oxygen compared to
Uh,
like nitrogen or something, not with oxygen, yeah.
uh, okay. Thanks.
Yeah. All the following are
Antisense agents.
what are antisense agents?
Let me search for you. Okay, so it's a form of treatment that uses antisense oligonucleotides to target messenger RNA. They're capable of altering mRNA expression through a variety of mechanisms. Okay, 1 minute.
Or you Google antisense drugs. See what it will bring.
Let's just say examples. Or seek to block DNA transcription or RNA translation in order to moderate many disease processes. Hmm.
Go back to the paper.
Okay. Okay, so I've gotten a list, but I don't know, nephrorenin, goserelin, homiviricin. Okay. So this all antisense therapy have the substem Bersen in their names. Okay, so D is out.
Sorry, Divya, you said what? They what?
The drugs have Bersen behind their name, the substem. So this one is an antisense agent. I'm trying to look for others. Wait, okay, I can't find anything to be honest. Anyone?
I also can't find anything.
Okay.
Antisense agents are designed
We
to
can start.
bind to specific messenger RNA molecules to block or modulate gene expression. They are used in various medical applications, including the treatment of certain genetic disorders and cancers. Vasopressin is a hormone
Hmm?
that plays a role in regulating water balance and blood pressure. So, okay, that makes sense. So basically, antisense agents are used like in cancer mostly.
Cancer, yeah.
Okay. Okay.
Okay. Mhm.
Which of the following drugs is metabolized by N oxidation? It's B. Imipramine and amitriptyline are the ones that are metabolized by N oxidation. I don't know if there are others, but what I've seen is imipramine and amitriptyline. Anybody got another answer?
I got the same as you.
Okay. All the following are non-benzodiazepine sedatives, sedative hypnotics except
The non-benzodiazepine sedative hypnotics are zolpidem, zaleplon, zopliclone, and esopliclone. I don't know about this. So this and this are out. It's one of these two.
even Remilton is a
Is-
non-benzodiazepine.
Then
Yeah.
that's your answer.
The fluvoxamine is a SSRI.
Okay.
Angiotensin 2 formation results in the following except
Oops. Sorry.
yeah, A makes sense because it doesn't affect liver function or hepatic function. Which one of the following hyperlipoproteinemics is an HMG CoA reductase inhibitor? Atorvastatin. All the statins are HMG CoA reductase inhibitors. Since we are on it, we can see what the other classes are, what the other drugs are. B is the bile acid sequestrants. C is selective cholesterol absorption inhibitors. And the last one, the fibrate. It's a fibrate. All the following are anti-metabolites used as useful as anti-cancer drugs, except yeah. I'm trying to see what the other drug was. Just go up, Divya. What was it? Pentostatin. I'm seeing that it's also an antimetabolite. And it's also used as an anti-cancer drug.
Really? Hmm.
It's doxorubicin.
Doxorubicin is.
It's anthracycline. It's not antimetabolite.
Antimetabolites are the ones that are this of purine and pyrimidine analogs.
So apparently doxorubicin is an anthracycline. Okay. Hmm. Some of the antimetabolites are 5-fluorouracil, capecitabine, floxuridine, cytarabine, gemcitabine, decitabine, and vidazar. So I don't know about pentostatin. Hmm. Okay, yeah, pentostatin is an antimetabolite. Okay, I guess it's doxo. Someone's written something. Can we say doxorubicin is an antibiotic? Okay, so we can just come back to this one. Maybe we can move to the next. Okay, so in zero order reactions, the rate is dependent on the intensity of incident light, dependent on the concentration of products, independent on the concentration of reactants, and independent of temperature. Independent of concentration of reactants.
Yeah, true.
Okay. Okay. Accelerated stability studies are conducted at 30, 40, 65, and 80. Could it be 40?
It's B.
I think it's B. Anyone? Personally, I'm thinking 40, but if anyone has a different opinion, you can share.
Okay, so I'm seeing here, they're usually at 40 degrees, and the humidity, the relative humidity is usually at 75%. So those are usually the conditions for the accelerated study.
Pardon, your humidity is at
75%. Can I be hard?
70. Okay.
Yes. Yes.
Okay. Okay, thank you. So we move. All right. Which one of the following is a physical chemical incompatibility? So there is potentiation of the therapeutic effects of the ingredients, occurrence of a toxic manifestation within the patient, destruction of the effectiveness of one or more of the ingredients, and a visible recognizable change due to interaction between the ingredients. It's a physical chemical incompatibility. Potentiation of the
Yeah, I think that one should be D, because that's the only one which can actually be seen compared to the others. So no.
Anyone else who has a different opinion? Which of the following drugs does not undergo hydrolysis? There is cocaine, procaine, benzyl penicillin, and salicylic acid. So I'm saying drugs that undergo hydrolysis are, oh, never mind. It's not.
I think it's benzyl penicillin. I'm not sure.
What makes you say that?
Because I know procaine and salicylic acid, they're both hydrolysis by water. This one, I think it's hydrolysis. Procaine is, it has nini metabolite which is called bara something acid. This procaine and salicylic acid. That's, I don't know cocaine. I'm not sure of cocaine. Let me check cocaine. It's hydrolysis.
I think she's correct. The answer is I think it should be salicylic acid because in itself, like salicylic acid is already a product of hydrolysis from aspirin. Because see, when we usually break down aspirin, we usually have acetic acid and salicylic acid as the byproducts, which are no longer active. So, what do you guys think? But I've also seen all the others undergo hydrolysis. And then also another way to look at it is most times like we'd expect hydrolysis from like a strong base or a strong acid, and salicylic acid in itself is not a strong acid.
Mhm.
Actually, you're right, Willie, because salicylic acid, it does not undergo hydrolysis. It's prepared by hydrolysis. Because there's hydrolysis of methyl salicylate that forms salicylic acid. Yeah. Plus, it undergoes conjugation, not hydrolysis.
Application, not hydrolysis. Okay, so we move or
Yeah, we move.
okay, so which of the following factors is not a component of the Arrhenius equation as applied in reaction kinetics? Absolute temperature is there, gas constant R is there, activation energy is there, so pH. Anyone who thinks otherwise? Anyone who thinks otherwise? No, right? Okay. Which of the following reactions represents an alpha radioactivity decay? Because of the helium, I'm gonna go with C. You guys are okay?
Yeah.
Okay, and then the Can-Ingold pre-log convention used to describe configuration about a chiral center uses dash symbols RNS, D and L, RNS, Z and E, plus and minus. Is it the Z and E? Could it be the Z and E? I don't know. Just a minute. Okay, I'm personally thinking Z and E. If anyone has okay, so the purpose of the CIP system is to assign an R or S descriptor to each stereo center and an E or Z descriptor to each double bond, so the configuration of the entire molecule. Gaius, there was this article I saw a few weeks ago. It was saying Z and E, not R and S. It's a pre-log convention. So I don't know. But we can always search.
It's RNS. Divya, you want me to continue?
Yeah, you can. Thank you, please.
Okay. Which one of the following acid gives rise to chlorate ion? Yeah, C is correct. D would be perchlorate. Which of the following analytical instruments employs a radio frequency receiver detector?
I'd go with A because just because it has the name nuclear already in it. But I don't know.
Uh, which of the following has the lowest mass? Sorry?
For number 84, have you checked? The answer is A.
I'm not sure about, but whatever you said makes sense.
Let me just check.
But I'm not sure.
Let me just check. So letting
Yeah.
us.
Yeah. Okay, which of the following has the lowest mass? It's an electron, right?
Neutrino.
A neutrino. Okay.
Why is it neutrino?
Neutrinos are they are almost weightless, but they do weigh a little. So they do, but electrons and positrons they weigh the same because a positron is just an electron with a positive charge, and a neutron has a much heavier weight. So the neutrino would be the answer.
You said electrons and
positron. So
positron. I thought it was protons. Okay, fine, that makes sense.
Material. It is now made with 82% recycled yarn while maintaining the softness and comfort you love. Electricity.
Which is what is the name of the following chemical ring system? Okay. Phenylethylene ethylamine reacts with carboxylic acid halide to form a isoquinoline through
I sent something on the group. It's about the Bishlan Neprialsky synthesis of isoquinoline. You guys can have a look at it.
Okay. The IUPAC name for the following compound is it's 2-methyl pentane. Which of the following physical properties is not correct for ethanol?
The lethal dose, maybe?
There was something up there that I saw. Was it 1 nanogram per kilogram? What was it? 1 nanogram per kilogram could be lethal. Oh, never mind. Sorry, I was looking at my.
Okay, here it's no. Okay, I'm not too sure about that.
Livia, can we go to the next question? You just put us down that one. Yes.
Okay. Which of the following forces cause nonpolar molecules to aggregate? Ionic interactions, dipole, dipole. interactions, van der Waals forces, and hydrogen bonding interactions.
Van der Waals forces.
Non-polar molecules to aggregate.
Yeah, because dipole is polar molecules.
Mm-hmm. All right, consider the reaction below, CH3BrCH, Br2. What is X most likely to be? 1,2-dibromopropane, 2,3-dibromopropane, 3-bromopropane, and 1,2,3-tribromopropane. There's a Br here.
Yeah, I think the always be have 3 bromines. So,
Wait, means
uh-huh.
for B, if it's a propane, and is the right way of naming it 2,3? Like, why aren't we putting the bromine in the 1 position? Like, if it's just a 3 carbon
I'm saying D.
or D, or
Because we have 1 bromine already inside, and then we have 2. We're adding 2 apple at the end, so we'll have 3 bromines if we're only forming 1 product at the end, eventually.
But are both the bromines added? I thought it's only one
yeah.
bromine is substituted, and then HBr is like the leaving group or whatever.
And then Gaius, with the
Yeah, you're
double
right.
bond here, don't you give the double? Okay, yes, even though the double bond breaks. Sorry?
Oh yeah, I hadn't even seen that double bond.
Okay, so if the double bond is here, doesn't this carbon get priority to be number 1?
Yeah.
And then,
Yeah.
as Hiral said, one bromine it's only one bromine that gets added. It's not both of them. Yeah, so I don't know, maybe 2,3-dibromopropane.
But now I'm wondering if we're breaking the double bond, wouldn't we use both bromines to cover both spots? Am I making sense, Ko?
You see, when you're breaking the double bond, I feel like HBr is formed as a byproduct.
No, I don't think.
Or
I'm thinking.
Uh-huh.
Why would we form HBr if, since we're breaking the double bond, we no longer have. You see, like there were 2 slots which were empty, and when the double bond is broken, those 2 slots are filled. Am I making so? It's not even necessarily a substitution. I think it's an addition. What do you guys think?
Yeah.
Yeah.
For it would be both the bromines are added.
Yeah. So
because it's an alkene, yeah.
Yeah.
So D would be the answer.
Yeah.
Yeah.
But so can we in such type of reactions, do both get added, or because I'm also seeing as if a HBr is usually formed somewhere?
Yeah, actually both are added. The HBr will be formed as a byproduct, but that comes into balancing of the equation because you'll have to balance the equation. So just
okay.
But both bromine atoms will be added
to this
yeah,
compound. Okay.
Yeah, because the double bond, that means 2 carbon atoms will have 3 bonds. So meaning the carbon atom has to always have always has to have 4 bonds. So means you have to add a bromine to each of the carbons with 3 bonds. That is the carbon which were bonded before by the double bond. And then the hydrogen bromide will also be formed as a byproduct. But yeah, that actually comes to, yeah, that part will be, you'll be balancing the equation.
Yeah.
And I'm also seeing that if it was an alkane, then only one
Mm.
bromine would be added. But since
Yeah,
it's
for,
an alkene, both the bromines are added.
yeah, so for alkenes and
If two bromines are added, so why is it tribromo? Are we balancing something?
Because they
It's
would already
There's already a bromine here. I don't know if you can see it.
Oh.
Yeah.
Oh, together with that, it will be 3.
Mhm.
Okay.
If you add these two bromines, yeah.
Okay. So the sigma bond will be open, and the two bromines will be added.
Mhm. From what was said, yeah.
And what about hydrogen bromide? It will not be.
That was my question initially, because I felt like HBr was going to be a byproduct.
yeah, it's going to be a byproduct, but you'll have to balance the equation from then on. Okay, I don't know how to explain it in simpler terms, but you can just check somewhere online. You can just search for you'll see how it actually proceeds, but it's formed as a byproduct.
Okay.
Oh no, actually in this particular case, I don't think we actually won't have the hydrogen. Oh, we actually will. We will. Sorry.
How would we have a hydrogen bromide? Wouldn't, because this is Br2.
No hydrogen being produced actually. Yeah, because when you break the bond, the moment you break the bond, you
It's substituted by the bromine
yeah
with
yeah
both molecules, right? So there wouldn't be any HBr
yeah there won't be any
in
HBr.
this case. Yeah.
So we move?
Yeah,
Yeah. Okay, so sorry. Which one of the listed products will be the most probable from the following reaction? So there's this, and this. Could it be C? Because if this double bond breaks, it comes here, and then the electronegative iodine attacks. I don't know if you guys are getting the chain of thought.
It should be A.
A,
Yeah.
why?
You said which one? Sorry. Which one are you saying?
I was saying C because if this bond breaks, excuse me, if this bond breaks, doesn't it, and then the iodine attacks, doesn't this bond come somewhere else? Because I mean D is out by elimination.
I
I
think
is also out. I mean B is also out.
I think for C,
Mm-hmm.
we'd be assuming that we have an added carbon. Simply, of course,
Yeah.
the
Oh yeah,
the
it's a
end.
methyl.
Yeah,
Oh,
yeah,
okay. Sorry. Sorry. Yeah,
yeah.
makes sense.
No, so
Yeah. Everyone okay? All right. Okay, so what is the product Y in the anti-Markovnikov addition below? Yeah. HBr, heat. I guess this is the catalyst, so this breaks, right? HBr attacks. It's a CHBr CH2. Could it be B? Because I'm by elimination, A is not there because they're not two BRs. And then the double bond, this is 2, not 3. H2BR. The double bond breaks, so I think it's B. Anyone who thinks otherwise?
No, I'm also with you.
Yeah, all right. Anyone else who wants to add something?
Maybe someone can remind us of Markovnikov and anti-Markovnikov addition reactions of the rules. Like what is the difference between the two?
Personally, I don't remember, so if someone else can help.
Okay, so Markovnikov is where the halogen is is substituted in like a bulkier place. And anti-Markovnikov is when the halogen is it causes like the halogen to be substituted in a less substituted position. I don't know if that makes sense.
Yeah, it makes sense. It makes sense. Okay, we can move.
Okay, so which of the following is not true about esters and alcohols of similar weight? Actually, ethers, sorry. Ethers have a lower boiling point. Alcohols generally have a lower melting temperature. Alcohols are better hydrogen donors. Ethers are generally less reactive. Anyone?
I was thinking B. Thinking B.
Yeah, I agree with you too. Because ethers, they do have a larger alkyl group. So they have higher boiling point than alcohols. So alcohols will have lower boiling point than ethers.
Wait, Abu Shafi, repeat what you say.
I said ethers, they have larger alkyl group than alcohols. So they will have higher boiling point than alcohols and melting point. So they have a lower melt.
Isn't it the other way around?
Yeah,
It
because
is having
even
a,
though things,
So alcohols will have higher melting point.
yeah, because of the hydroxyl group.
Yeah,
They are able to form hydrogen bonds better than ethers.
ethers,
So it
yes.
will have a higher.
Okay. So what in this case, what's the answer? Ethers have low boiling points.
Okay, by elimination, C and D
A.
are out. Right?
Alcohols ethers are generic. Yeah, and A is true that ethers they usually have lower boiling points.
So you're only left with B.
Yeah.
Okay. Okay, which product is the most stable in the bromination of nitrobenzene? Ortho, meta, para, dinitro. Ortho bromonitrobenzene, meta bromonitrobenzene, para bromonitrobenzene. Ortho para dinitrobenzene. We know one of these structures are more stable compared to the other. I don't know whether it was 1, 2.
B, right? I think ortho and para are more stable compared to meta.
Yeah.
I would go for D, but I'm not sure.
Also open para more nini than kina nani? Than meta.
Yeah, there's something to do with like resonance structures that when
Okay.
when you're drawing resonance structures for ortho and para, they have I think more resonance structures, making it more stable compared to meta. So ortho and para are more stable compared to meta products.
Oh.
Yeah.
Okay, 1 minute, sorry. I don't know what the hell I've just done. Yeah. So you said ortho and para?
Yes.
Okay. Which of the following statements regarding agonists is true? A receptor binding triggers a response. A structurally similar to similar to endogenous body chemicals, lack affinity for the receptor site, and they tend to be highly specific. Not true.
I think that one they lack affinity.
Affinity.
Yeah, because they do have some degree of affinity.
Yeah. Which one of the following statements regarding physiological antagonism is true? The two agonists compete for the same receptor. It is of no clinical importance. It's usually irreversible, and the antagonists are not structurally similar. Mute. Antagonism is true. Okay.
Just by elimination, I think we'd go for A.
Yeah. Okay, a competitive agonist has affinity but lacks intrinsic activity. It binds irreversibly to a receptor, reduces the maximal response of the dose response curve, and causes a left shift of the dose response curve. Competitive antagonist.
Isn't it supposed to be A? Because isn't it that antagonists have affinity, but they don't have that intrinsic activity?
Yeah.
Okay. Neutralization of gastric. Sorry. What?
Could you just go back to 97 for a second? That one about physiology.
Yeah.
Compete. So yeah, you guys you've gone with the answer B.
We've gone with A.
Yeah.
As in
Because okay, what
mm-hmm.
is like in physiologic antagonism, it's for example, let's just work with an example so that it's easier. it's like insulin and glucagon, they are physiologic antagonists in that one functions opposite of the other. So do they compete for the same receptor? Because me, with this, I'd now go with they are not structurally similar. Because like just from Google about what physiologic antagonism is, it's whereby one is doing, for example, insulin is lowering blood sugar, glucagon is raising it, but they don't act on the same exact receptor per se. I don't know if anyone else is finding a different thing.
Yeah, I'm also seeing with physiological antagonism that
Mm-hmm.
that it could be D because they're not, like you gave an example for insulin and glucagon. Yeah,
So
if in that case I would also go for D then.
yeah, I've seen even somewhere that okay, I've seen it in Wikipedia that they bind to different receptors. Yeah, so it's D. They are not structurally similar.
Okay, so we move.
Regardless.
Okay, so neutralization of gastric acid by sodium bicarbonate is an example of non-competitive antagonism, chemical antagonism, physiological antagonism, and pharmacological antagonism.
I think this one is chemical. What's
Chemical.
acid plus base? Yeah.
And then which of the following routes of drug administration is least likely to result in systemic absorption? Topical?
Yeah.
Vitamin B12 is absorbed through endocytosis, active transport, passive diffusion, and reverse osmosis. Oops, sorry. Oops. Yeah, 101.
B12, was B12 the one using that intrinsic factor from the Nini?
Yeah.
Yes.
Yeah.
Okay. I just wanted to ask. I don't have the answer.
Oops. Sorry.
Yeah, it's passive. Yeah, it's passive diffusion. B12.
Passive or endocytosis?
Oh, wait, there's what and what?
Endocytosis.
Yeah, it's
Ah,
endocytosis.
yeah, endocytosis. Yeah.
Why do you say that?
Here it says it's absorbed by endocytes via receptor-mediated endocytosis via the apically expressed intrinsic factor CBL receptor. Yeah, that's all. That's all.
Yeah.
Okay. Which of the following does not promote penetration through the blood-brain barrier? Small particle size, inflamed meninges, high lipophilicity, low molecular weight. Does not promote penetration through the blood-brain barrier.
I think I'd say low molecular weight. What do you guys think? When I'm thinking small particle size, probably does.
Small
Yeah, I feel
particles.
like it does. What
What
about
do you think, guys?
inflamed meninges though?
Yeah, inflamed meninges, I think it's more
Inflamed
drug.
it, yeah.
The-
More drugs
I think
penetrate when
More
it's
drugs
inflamed.
penetrate.
Yeah,
Yeah.
when it's inflamed.
because now if
Oh.
they're inflamed, it means like all meninges are much larger. So do you guys think it's low molecular weight?
But okay, particle size. Do we talk about particle size when a drug is in the blood or when it's in the GIT?
Doesn't it depend? I don't know.
I think for me, I was just comparing like low molecular weight and small size, and I was just thinking if we're talking about permeability, then at the end of the day, like the smallest particle would still be able to pass through because now we are talking about like the way we say veins, venules, and then capillaries, and that's still the same thing which is going on in the blood-brain barrier. So if we have capillaries which are the smallest, then they're likely to allow the smallest particles to pass through. So I was thinking low molecular weight, provided they can move via the blood, I think, oh, what do you guys think?
Okay, so really, you're going with D.
Yeah, me, I was thinking D.
Okay, but low molecular weight makes more sense than small particle size.
Yeah,
But are you
yeah,
getting what?
Google
Uh-huh.
it says generally only lipid soluble molecules with a low molecular weight cross the BBB.
Oh, so
Yeah, generally, yeah. And everywhere they are talking about the molecular weight. I've not seen anywhere that they are talking about the particle size.
so.
Yeah.
Yeah,
Oh
so
yeah,
the question is
yeah, I've
asking
even
does
seen
not,
it. Yeah, I've seen it here.
but even the question is asking does not promote. So A is right.
Yeah.
Yeah.
Okay, so which of the following is not a means of drug elimination? There is renal secretion, binding to body tissues, fecal elimination, and drug metabolism. I feel like this is right.
Yeah,
Binding
we have
body
issues.
tissues.
Yeah.
Drug metabolism may result in drug inactivation, decreased elimination through the kidney, drug activation, and production of toxic metabolites. Drug inactivation, no.
Drug may result in drug inactivation. How?
No,
Okay,
I'm saying no. Like through
you.
elimination, A is out.
But okay, let me ask.
I think it should be the opposite. Like drug metabolism may not.
Yeah.
Yeah.
Or
Yeah.
rather, because see, when you
All the others
metabolize drug, you can
make them
inactivate or activate depending on drug it is.
Yeah, like I was saying, you can become with inactive.
We can't hear you, Willie.
Eh?
We can't hear
Or I'm saying you can hear me.
you.
Can you hear me?
Yeah, I
Maybe
can
the-
hear you now.
Yeah, Nasema, like how we were saying, like aspirin breaking down forms acetic and salicylic acid, or like when we break down drugs so that they can be conjugated. So I think the answer to the question is metabolism, not exactly because we know they can activate and inactivate drugs.
So if it was there was a note, you'd go with B.
Yeah, I'm good.
Yeah, me too. I agree with you. Because ideally, when you metabolize drugs, you make them more soluble. Because I feel like all like A, C, and D are all results of drug metabolism.
So you'd go with B.
Yeah, I'll also go with V because
But-
when it's metabolized, it decreases the therapeutic effect.
But you see, the question is asking drug metabolism may result in, not may not.
Yeah, that's what
Yeah.
we're saying. There's probably a problem in the question
Are we
because
sure?
it can result in all the other things. What do you think? Because it can activate the drug, it can inactivate it for it to like be removed. They can produce toxic metabolites. What do you think?
I feel like
Yeah.
I feel like they probably put it in a way that the first thing that happens when you metabolize a drug, you can leave alone production of toxic metabolites.
Mhm.
And yeah, so I feel like they want, okay, yes, it's a confusing question, but I feel like we shouldn't just try making our own questions.
Divya,
but
you
I'm
I also
still
agree
in
the
these
question
confusion?
these questions also have
is wrong
mistakes.
because that production of toxic metabolites is not really an answer. It's actually an answer because when you take paracetamol, like one of the byproducts, immediately it's being metabolized is actually a toxic product, the NAPKI, or prodrugs. They'll be metabolized to the active drugs immediately, so they'll be activated. The A, C, and D are actually correct, apart from B. So I also have a feeling that the question was wrong because one choice cannot be wrong.
Yeah, I mean, yeah, like using the answers alone, B is
The only odd
off.
choice.
Like assuming you don't have a question, you'd say B.
Okay. So responses
Yeah,
other
yeah.
than the intended therapeutic on are responses other than the intended therapeutic one or on, I don't know, are side effects, synergism, potentiation, additive effects.
Yes, side effect.
Side effects, right? Yeah.
Yeah.
Okay, so tolerance is reduced response on prolonged use of drug, associated mainly with the single drug use, due to sudden drug withdrawal, associated with all types of drugs.
I think that is a reduced response.
Yeah, okay. So which one of the drug is not a plant origin? There's quinine, cotrimoxazole, atropine, and artemisinin. Yeah, that's cotrimoxazole. Right?
Yeah.
And then which of the following is true about a prodrug? It's more active than the drug. It retards drug absorption. It's less stable than the drug, and it's activated by enzymes. I'd go with D as well.
It should be Divya.
Okay, so which of the following drugs has the longest delayed onset of action? Warfarin, adrenaline, acetylsalicylic acid, and pilocarpine.
Warfarin.
Yeah,
It takes a few days.
to kick in. Okay, idiosyncratic reactions are expected and extension of the drug action, related to the pharmacological profile of a drug, unusual and uncommon as due tolerance.
Yeah, unusual and uncommon, yeah.
Okay. A phenomenon in which the drug may not be beneficial or may do harm is known as addition, idiosyncratic reaction, induction, and contraindication. Yes. May not be beneficial or may do harm. I'm not sure. Okay.
I think by elimination, we don't do it because it's not addition, it's not induction, it's not contraindication.
Okay. The loading dose of a drug allows rapid attainment of the desired steady state levels, maintenance of plasma levels above the therapeutic window, less frequent dosing of a drug, avoidance of toxic reactions. Loading dose of a drug. Okay.
Yeah, so we usually have the loading dose and the maintenance. So loading is to achieve that desired, rapid attainment. Then maintenance, it's to maintain it.
Okay. Which of the following is the recommended route of administration for a drug with a short half-life? IV. Intramuscular is the slowest.
Mm-hmm.
Yeah.
Or
What about intra-arterial? You can't really. Can you? No.
not really.
Yeah, you can't. So I'd go with IV. What about you guys?
I'd go with you.
Okay. Which one of the following is associated with the least risk of drug toxicity? There is old age, reduced renal function, sensitization, and dose individualization.
The individualization,
And all of the following are produced by the use of DNA recombinant technology, except human insulin, EPO, human growth hormone, and penicillin. Yeah. Right?
Kinda.
Okay. Which of the following drugs does not produce tachyphylaxis? So there's ephedrine, amphetamine, tyramine, and pilocarpine.
Pilo doesn't
Tachyphylaxis.
feel like this. Yeah.
Okay. Which the part of the drug responsible for the activity of the drug receptor complex is called pharmacophoria. Prodrug isostere and structurophoria. Okay, structure activity relationships are used for designing all the following except pharmacological me-too drugs, antagonists, cogeners, physiological antagonists. No, agonists, sorry. Structure activity relationships.
I think it's okay, me I'd guess physiological agonist. Because physiological is something we already have. Like
Yeah.
pharmacological is when we are talking about drug, but physio is stuff you already have.
Yeah.
Yeah. Unless something of a different opinion.
Anyone? So we move. Why can't 16 be tyramine? Which of the following drugs does not produce tachyphylaxis?
Okay, for this one, maybe I was thinking in the line of tachyphylaxis is just it's the same as tolerance, only that you develop a reduced response, but after a short duration of administration of a drug. And
Correct.
now, especially
Also, tyramine it promotes the release of
Uh-huh.
noradrenaline. So if noradrenaline is released, then it causes tachyphylaxis, right?
yeah.
Yeah.
Yeah. And pilocarpine, we never saw anywhere where pilocarpine, I think, nini.
So they're saying but it's found in various food and not administered as drug. Anyone wants to respond to that? The chemical structure of a drug determines all the following except its affinity for the receptor, its intrinsic activity, metabolism, and its optimal excipients. All the following except. Yeah. D? Anyone?
The previous question, number 16.
Number?
Wanasema thiamine is less likely to cause anaphylaxis, but although okay to some degree with the chronic use it causes anaphylaxis.
To some degree.
Yeah.
Like you said to some degree.
Prolonged use.
But see, with prolonged, then that is not tachyphylaxis. That is now tolerance.
It's not the same adaptation.
No, actually, tachyphylaxis is like it's a response that it's a decline response due to continuous usage of the drug, which is different of the.
Usually, cynism receptors inaongezeka, which is also what happens in the lung. Let me send us.
Is tachyphylaxis not the same as acute tolerance?
It's exactly that, acute tolerance.
So if it's the same, the answer is pilocarpine.
Yeah, because I'm seeing the likes of SSRIs, monoamine oxidase inhibitors, these drugs that act and also the decongestants, they are notorious for tachyphylaxis. And I think tyramine, if someone can just Google what's the pharmacological effect of tyramine, as much as it's found in food, it does interact with the MAO enzyme somehow. In release of it's a sympathomimetic. Yeah, with this let me okay, I'll also send what
Yes, Spider-Man.
wrote here.
WhatsApp yako.
Umenitumia picha fani hapa. Kana shida mzee. Okay, from your explanation, imesema C, but hii ni chat GPT ama hii ni nini? Yeah, hii ni chat GPT.
Yani
Me, because tyramine is also a sympathomimetic, me I'd still go with dog, but I don't know sasa, because from their explanation wanasema pilocarpine can lead to tolerance with prolonged use. The fact prolonged use, that is tolerance, it's not tacky. Anyway, we can Divya, maybe we can try and we move while nini. Where do we reach?
19. The chemical structure of a drug determines all the following except affinity for receptor, intrinsic activity, metabolism, and its optimal excipient. I think optimal excipients. What do you guys think? Wait, I could be wrong.
D does make sense, but
Yeah?
yeah.
What about A?
Yeah,
think
you need, sorry?
Yeah, I'm with you, Hiral. Yeah, like A is
Okay, so it's intrinsic activity.
I think
Well,
yeah, because if see, we know antagonists, they're the ones which don't have that intrinsic activity because of they are attached to a large bulky group. So ideally, if you can decrease that, it can also determine whether a drug can or cannot have intrinsic activity. Like they are all looking like answers, but I'd just go with D.
D? You think D?
No, with optimal excipients.
Okay. Complete removal of a drug from a
Then
specific... Sorry.
Dr. Sam, no, Dr. Sam has just copy pasted an article here.
Yeah, on the chat, yes.
Yeah.
Do you want to read it?
It's pretty long.
And
Artistic soup.
that's what she
But
said.
in summary, they're saying pilocarpine there's no evidence showing pilocarpine causes tachyphylaxis. But for tyramine, actually found a source that says it does cause tachyphylaxis. So I think the best answer to go with was gas answer. The pilocarpine.
That's number 16. Yeah, pilocarpine is highlighted. Yeah. So we move?
Irregardless.
All right. Complete removal of a drug from a specific volume of blood per unit of time is pharmacokinetics, bioavailability, volume of distribution, and clearance.
That one.
Yeah? Okay.
Yeah.
Half-life of a drug is time required to eliminate 75% of the drug in circulation, influenced by the rate of metabolism, decreases in patients with liver disease, and reduces when drug absorption slows down.
May I go with it's influenced by the of metabolism.
Yeah, I would also go with that.
The volume of distribution of a drug depends mostly on plasma protein binding, renal excretion, route of administration, drug formulation.
A.
Yeah.
Yeah,
Okay.
PPB.
And then which of the following routes of drug administration is associated with the highest bioavailability? Oral, IV, sublingual, and IM. Highest bioavailability. IV.
Yeah.
The rate of absorption of a drug can be increased by reducing drug particle size, formulating as an oil suspension, injection of adrenaline at the site of admin, and topical admin. Can be increased by reducing
Particle
particle
size.
size, yeah?
Yeah, kina disintegration.
Yeah, the trough in plasma concentration curve of a drug is the upper limit of a drug's concentration in blood, the peak plasma concentration following a single dose, steady state plasma levels, and the lowest level of a drug in the blood. I'd go with D, but since our trough is this,
Yeah.
yeah,
The top part is called the what?
peak.
The peak. Wow, this is why I got a C in English. Don't know what.
Okay. All the following reduce oral bioavailability of a drug except first pass metabolism, high water solubility, complexation reactions with dietary components, and esterification of polar parts of a drug molecule. I'm not sure about this.
Well, okay, we know A and C are true, right?
Yeah.
Yeah. So when a polar part undergoes esterification, how does it affect solubility? Is it more soluble or less soluble? High water solubility.
Sasa umesema esterification inafanya nini? Kindly repeat.
No, nimeuliza what will happen if you a polar part is nini? Sasa ujibu juu umeunmute.
Sikuwa nimeunmute.
Esterification actually increases the solubility. So in this particular case, it makes it more polar. So if it's on the polar parts, I don't think it has any effect because the parts are already polar. So I think, okay. Okay. But it increases polar solubility if I'm not.
So you're saying it makes it more soluble?
Actually go with B because if you're esterificating parts, I don't think we're going to improve any solubility because it's already soluble. We're already adding a polar group to another polar group. So I don't think there's any new change in that, but I'd actually go with B, but you can confirm it.
So you're saying a high water solubility will will reduce oral bioavailability of a drug. So a high water ability will increase bioavailability.
Means it's more lipophilic. I mean, more hydrophilic and not lipophilic. So crossing the membrane barriers, it's gonna be a problem because it's less.
Because I was also thinking in lines of that, and I'm like, something that is highly water soluble, it means crossing the lipid bilayer will be a trouble.
And for D, okay, D, I don't think causes any change because the certificate improve polarity, but we are sterifying the polar groups. So, okay, we can just confirm it.
I agree with you, Samuel, because esterification of polar, it makes it more polar. It won't make a difference.
Samia has something on the chat.
Low bioavailability.
No, go ahead.
Okay, so low bioavailability is most common with oral dosage forms of poorly water soluble. Okay.
So stuff that are not water soluble have a low bioavailability. So yeah, then it's B. So stuff that are highly soluble have a higher bioavailability, right?
Yeah, I guess. So we move?
Irregardless.
Okay. A ceiling effect of a drug occurs when no clinical response occurs with increased dosage, proteins involved in active transport are saturated, renal excretion is overwhelmed, and tolerance occurs.
Ceiling effects ni?
Ceiling effect is when the drug reaches its maximum effect. So even if you increase the dosage, it wouldn't affect like the effectiveness. Yeah.
Okay, Samiha has written phenomenal. Okay, yeah. All right, so
it's A.
yeah, it's A. Okay, so drug interactions involve all the following except enzyme induction, drug complexation, decreased renal secretion, penetration of the blood-brain barrier.
Yeah, I think that BBB.
Okay, which of the following statements regarding D-amphetamine and L-amphetamine is not true? Oops, sorry.
What at 9:30 p.m. What's wrong?
Sorry. So it's not true. Okay, the options are occurs as a racemic mixture, enantiomers. Okay, someone sent something.
Sam is saying
Oh wow.
Certification
That's from
Sam, go ahead.
Oh, it's from an AI, but they're saying the answer is D. So the explanation is that they're ruling out the other answers, and then yeah, it's long. You can read it in your own time.
Yeah.
Yeah, that's what.
So she's right.
What? Okay. huh. So, which of the following statements regarding D-amphetamine and L-amphetamine is not true? It occurs as a racemic mixture. Their enantiomers have similar pharmacological profiles and interact differently with receptors. See? Have similar pharmacological profiles. Racemic mix, okay. Hmm. What do you guys think for 129?
C.
So a lead compound is a new molecule proposed for a particular therapeutic use, most effective molecule among a class of related molecules, lacks a chiral center, and is the starting material for the synthesis of drugs. D.
Definitely, Divya, definitely.
What was a hit?
Munyendo.
Munyendo ama Yasodha.
Pia Munyendo alifundisha.
Okay.
Hit lead.
I feel like even what's his name, Yasodha covered it in. Yeah. Okay. So which of the following is a hepatic microsomal drug metabolizing enzyme? Xanthine oxidase, mixed function oxidases, aldehyde dehydrogenase, and alcohol dehydrogenase. Microsomal drug metabolizing enzyme. Okay. Oh my God. So, what do you guys
Hit
think?
iko kwa charge.
Okay, heat compound refers to a chemical compound that shows promising initial activity against a specific biological target or disease in the early stages of drug screening and evaluation. Heat compounds are typically identified through high throughput screening, HTS, or screening methods used in pharmaceutical research. Okay,
Nice. Thanks.
nice. So
You
what would you
can answer the AI. Actually, saying B is the answer. So,
mixed
did you
function oxidases?
find the lead compound as well? Because I'm also doubting whether it's the starting material, because it's actually used as for the synthesis of drugs, but is it really the starting?
Yeah. Now that's the question. What's a heat? Because we were saying heat to lead. Heat was for lead. It's a new molecule proposed for a particular therapeutic use. The most active molecule that it is identified during drug. So it's boy.
Yeah, we go with boy.
You'd go with boy. That's
And
personal.
the most promising one, meaning it has more pharmacological activity than that is what is taken as the lead.
Because according to Wikipedia, it's saying a lead compound is a biological representative of a compound series with sufficient potential measured by potency, selectivity, pharmacokinetics, and physiochemical properties to progress toward full drug development program. Yeah, so I also think it's B.
So Yeah, so Divi, you can highlight the
I highlight what?
that it's B, so that D doesn't
It's
doesn't
done.
confuse someone.
Yeah, she's
Number one,
already done. Mm.
it's done. Oh, guy. Oh, I guess my screen is okay.
Okay, so can someone please read the questions?
Which one of the following is a hepatic microsomal drug metabolizing enzyme? Oxidases, right?
Yeah, I was also thinking the same. See, the CYP system, we also call it the mixed function oxidase.
Yeah.
Then it's that one.
Anatomical fetal anomalies due to action of a drug during period of organogenesis is known as teratogenicity. The antidote of paracetamol overdose is that one, yeah.
I'll picture the answers and then you get also the other, like for the antidotes. These are the choices, yeah, just revision.
Yeah. Yeah, Naloxone,
Upwards.
atropine, we have organophosphate. Then for benzos, okay, benzo is what you'd overdose with. Now the antidote for benzo is the flumazenil.
Flumazenil.
Yeah. And this drug is expensive.
Which one of the following is a cholinesterase enzyme activator?
It's the pralidoxin,
Yeah. Which one of the following is indicated for iron overdose? Yes, those ones. They're the iron chelators. Pain and inflammation arising from a bee sting can be relieved by all the following except
Just a question. For question 134, we went with C. Yeah, that one.
Yes. Yeah, we went with C.
Oh.
Why?
Pyridoxine isn't usually an antidote for acetylcholinesterase.
No, see, it's used for Nini. It's used for what? It's also used for organophosphate poisoning. Because in organophosphate, see, we have the poison binds to pardon?
What does the poison bind to?
It binds. Okay, I know it increases the level of acetylcholine is too much.
Yeah, because
so acetylcholinesterase, it binds to it irreversibly. But now pralidoxime comes to activate the acetylcholinesterase so that it can break down the acetylcholine that has built up. So that's why it is an antidote. Yeah.
Thank you.
Number 136. Sam, that one is for you.
Mm. I'm not sure. I'm not sure.
I think
Okay.
C.
Yeah, those
Yeah.
who go with, because we've only seen this stuff being used in asthma. I mean, yeah, but from its MOA, you can argue that it can be used, but we've only seen it being used in asthma. Antidote for
Okay, go carry on.
or antidote for methanol poisoning is the fomepizole. And drug of choice for hypomicrocytic anemia. This one will be iron ferrous sulfate because it's micro.
Yeah, true.
So then we can go to the next one. Then pernicious anemia is associated with malabsorption of other vitamin B12, yeah, the intrinsic factor. Chemo-induced neutropenia can be reversed by filgrastim, yeah. Those are colony stimulating factor. Oh, Coach has texted me that she wants to read, so let me mute.
Which the floor is yours.
Hey guys, text. The role
But when you
As you may unmute.
142.
141.
41. The ophthalm is due to deficiency of, maybe ameshindwa kusoma hiyo jina.
Nakumbuka.
So I guess because of hiyo ya macho, so tunaweza na yeye ama.
Yeah. Juni macho.
Ulikuwa unasema unakumbuka? Sorry.
Okay, demewa na glomerulo. Haya.
Sawa, tunaweza endelea.
Bora mjibu. The role of calcitonin in the body is to enhance the synthesis of urine base, regulate calcium homeostasis, enhance the synthesis of clotting factor 2 and 7, strengthen connective tissue.
I think neo
Calcium.
calciton was it the one inatolewa somewhere hapo kwa thyroid, like sijui some types of cells in the thyroid.
Ni hizo.
It was called which type of cell?
T
hiyo
cells,
yenye ehe,
the C cells ama chief cells.
T cells.
CCL.
Ah, thank you. Hey, you guys. Respect. Go ahead, tuendelee.
Concurrent administration of probenecid and piperacillin may cause prolonged blood concentration of probenecid, prolonged blood concentration of piperacillin, increased urine concentration, increase of piperacillin or increased urine concentration of probenecid.
Prolonged blood of piperacillin.
Mhm.
Probenecid,
Reason?
yes. It reduces renal excretion of penicillins as a whole. So it increase blood concentration of the penicillins.
Nice, thank you.
You're welcome.
Okay,
Drug
so
index.
B, 143B. 144, which one of the following is a neuramidase inhibitor? Cyclovir, foscarnet, zanamivir, cidovifir. Guys, answer.
Sasa unaanza alafu natuambia pengine pia classification juu wewe umeivisha.
Si nini neuramidase, ni hiyo the indicated answer zanamivir.
Na hizo zingine like ziko which class?
Hizo zingine ni we have foscarnet ni DNA polymerase inhibitor. Cidofovir also it will also inhibit DNA polymerase. Acyclovir also do the same DNA polymerase, but also in a cause it's a suicide inhibitor of inhibit peer elongation of the chain. Yeah. So in short, all of these agents is the herpes family. Foscarnet, cidofovir is a ile cytomegalovirus. So you can just say all, basically we can just say all inhibit DNA polymerase.
Okay. All the following are non-nucleosides reverse transcriptase inhibitors except nevirapine, delaviridine, efavirenz, apremnavir. Guys. Or anyone.
Yeah, anionea.
So nevirapine hiyo ni na nucleoside iko sawa. Na nitasema zenye najua. Pia efavirenz bado ni na nucleoside. Alafu ni gani dela. Hiyo sijui hizo mbili sijui sasa.
Hadi dela it is. Yeah. So hiyo ni elimination. Hii drug ingine I don't know. Hiyo maybe nani anaitwaje Jasmila ndio ako into these new drugs.
Hypertension can be exacerbated by oral contraceptives, indomethacin, prednisolone, paracetamol.
I think ni cannot.
Cannot.
Cannot, sorry.
Ni PCM yakwanga very safe.
Cardiac glycosides are contraindicated in constrictive pericarditis, dilated cardiomyopathy, cardiac arrhythmias, congestive heart failure.
These are cardiac arrhythmias.
Why would you say that?
Because
Yeah.
I think like we're seeing glycoside. So that's like just from the glycoside, manufacturing, we have arrhythmias where we have heartbeats. So now we're going
On a
to
break. I don't know, kama ni just from my end. Could you please?
unaweza nisikia sahi.
Yeah.
So I'm saying,
Yeah,
I'm
yeah.
saying that cardiac glycosides. So just by
Mhm.
itself, even just from the name, it's like now we're giving glucose to the heart, therefore increasing the just basically like from the most basic, we're increasing the heart rate, we're increasing, and we already have arrhythmias. So if we increase the heart rate, now we're increasing the regularity of the irregular heart rate or the arrhythmias in them. So basically to use irregularities to like just from a basic, I'm pretty sure gas can give a better answer. But yeah.
I was to ask,
Uh-huh.
cardiac glycogen. Digoxin is a good example of a cardiac glycogen, right? But
Thank you, sir.
see, it's given for a specific type of arrhythmia. If I'm not wrong, I'm seeing as if there was a type of arrhythmia where we can give digoxin.
Yeah, so they are like digoxin is given in cardiac arrhythmias.
Mm-hmm.
Yeah, so it
can't be a concern.
Nachukia hapa ina
Really contain one particular arrhythmia, so I think I'd go with that. I think they're contraindicated apart from maybe that particular arrhythmia where they're given, which is only one type of arrhythmia there, which is very rare also. So I'd actually go with, but we can confirm it. I think it's the Wolf Parkinson something. I don't know. It's
AF, atrial fibrillation. Yeah. Maybe okay. Someone can just search management of constrictive pericarditis, and someone else will search management of dilated cardiomyopathy. Then we see.
Kwa hiyo pericarditis na cheki mainly tunapeana NSAIDs and for hizo, alafu pia kuna cardiac catheterization. Hizo ndo nilipata. But which makes sense kwa sababu sa hiyo pericarditis inamaanisha kuna hiyo inflammation of the pericardium.
Yeah.
Pia unaweza peana steroids for
pia unaweza peana steroids, yeah, obviously cause pia hizo zitakuwa na an inflammatory effect, sindio?
Yeah. Let me just share this screenshot.
okay. Acha nisomange the dilated cardiomyopathy, like the management. So amesema the main like management depends on like the underlying cause, the severity of the symptoms, alafu presence of complications. So you can give medications such as S inhibitors that improve the heart function and blood flow. So kama S inhibitors, anticoagulants, antiarrhythmics. This help relieve symptoms such as shortness of breath, fatigue, swellings, and chest pain. And then ideally pia unaweza patiana devices such as defibrillators, pacemakers, ventricular assist devices, and then surgery may be used in cases where the underlying cause such as valve repair or replacement. In rare cases, heart transplants may be considered for patients who have severe and irreversible heart damage and do not respond to other treatments.
I was thinking like all the other alternatives that we had here. Okay, maybe other than the pericarditis, hizi mbili, dilated cardiomyopathy and CHF, mostly like increasing the heart function is a good thing, you know. I think for the constrictive pericarditis, it doesn't really matter if we increase or reduce. Lakini hiyo cardiac arrhythmias, most likely, especially if they're tachycardias, because it's not just specify, like it would be a very bad thing to give, you know, digoxin or anything of the sort. What do you guys think?
Hey, Willy.
Niambie.
Oh, London, nimekuwa disconnected for a bit.
Nasema
Mhm.
naona kama answer. Sasa hapa nimeona I think hiyo answer ni hiyo cardiac pericarditis, hata ndo nimecheki tu hapa. Nimeona cardiac glycosides are contraindicated in conditions in which there is obstruction to ventricular outflow. For example, hypertrophic obstructive cardiomyopathy, constrictive pericarditis, and cardiac tamponade.
Sawa, si basi cause hata mimi ndio nimetoka tu kuona Medscape. Yeah, it's the same, neo constrictive pericarditis.
Yeah, okay. So that's our answer. Can you change that 147 we put A?
Then synthesis of DNA can be inhibited by we have the fluoroquinolones hapo. Cipro. The carbenicillin, ceftazidime, those ones, they inhibit cell wall synthesis. The gentamicin is protein. Yeah. Inhalation of corticosteroids can cause oropharyngeal infection with the Candida albicans. Then, okay, because we are on this for we can revise management of cryptococcal meningitis because it's
tell us.
Okay. Nilikuwa ngoja nini. Okay, so for cryptococcal.
Sorry? Ulikuwa unangojea nini pole? Sijasikia.
Management ya cryptococcal meningitis.
Oh, hiyo ya amphobia ama?
Those three phases. Kuna the induction.
Okay, shine.
No, kuna hiyo induction phase. Induction phase ndio ina last 2 weeks. Where the patient atapewa amphobi plus fluorouracil, but because we are told since Kenya we don't have 5FU mostly, they'll just be given plus fluconazole for 2 weeks. Then we go to the second phase, and it lasts between 8 to 10 weeks. They'll be given fluconazole, 400 mg, OD. Then lastly, the maintenance phase, fluconazole 200 mg, OD, until their CD4 count imerudi at a good level, because Cryptococcus majorly it's an opportunistic mycosis. So mostly we'll see it with people with HIV.
Yes, could you please repeat umesema the first phase? I think he'll kick you out, Casey.
Oh, the first phase in your induction phase, yeah, patient atapewa amphob plus flucytosine for 2 weeks. Then we have okay, I forget the name of that phase. I know it's 8 to 10 weeks. They'll be given high dose fluconazole, like 400 mg OD. Yeah, then lastly, they'll be given now fluconazole 200 mg OD, now in the maintenance phase, more of indefinitely, until their CD4 count ifike level 4, or yeah, mostly is just indefinitely.
Okay, thanks.
And then most effective drug for motion sickness, you have hyoscine, but they need the ear patch, not Buscopan idea. Drug of choice for typhoid fever, yeah, it's usually ciprofloxacin. Or then regarding number 150, motion sickness, this kina D2 antagonist, the likes of metoclopramide, domperidone, and also kina ondansetron, they don't help at all with motion sickness. So it's either you give the ear patch, but since local is usually not available,
Guys, can we continue from here tomorrow?
Yeah, sure.
See, when we're done with this paper, hopefully this week, someone will share the whole paper so that we can have it with answers. No. I think it's Divya. Divya, you the one who's no. And also Divya, like thanks for taking us through. We are extremely grateful.
You're welcome. So we start tomorrow at 1:52, right?
Yeah.
Okay, fine. All
Yeah,
right.
sorry for your
Right.
call, Divya. You guys
No,
have a good night.
you too.
Bye.
Bye.